Imagine a worm crawling inside your brain and you never even knew.
This isn't fiction. A woman walked into a hospital thinking she had a mental health problem and walked out with doctors holding a wriggling worm that had been living inside her brain. It started with stomach pain, diarrhea, and night sweats. Doctors couldn't figure it out. Then things got stranger. She began forgetting things. Her mood collapsed. She felt constantly unwell, but every test came back confusing. To most physicians, this looked like a psychiatric illness. Anxiety, depression, maybe early dementia. Nothing pointed to the real horror crawling inside her head. An MRI scan finally showed something unusual, a strange shadow in her frontal lobe. Surgeons prepared for a possible tumor, but when they cut open her skull, what they pulled out left them speechless. A live, 3-inch red worm, twisting inside her brain tissue. The operating room froze. No one expected to find a parasite usually seen in wildlife crawling around a human's brain. It was Ophidioscris robertsi, a roundworm that normally infects pythons in the wild. Somehow, this parasite had made its way into a human brain, the first documented case in history. Doctors believe the woman accidentally consumed the worm's microscopic eggs while foraging for wild plants near her home. Once inside her body, the parasite did the unthinkable. It migrated straight into her brain. This wasn't just bizarre, it was terrifying. If this worm could make the jump from python to human, what other parasites are lurking out there? And while this case happened in Australia, parasites don't care about borders. With global travel and food imports, the same could happen anywhere, including here in the United States. Doctors are now warning that unusual infections like this are likely to become more common as humans and wildlife collide. A woman thought she had depression, but doctors found a live python parasite living in her brain. Medical science is full of cases like this, shocking, rare, and hard to believe.
So the next time you have a simple headache, remember the truth is sometimes way stranger than what we expect. If you found this case shocking as I did, please hit the subscribe button because the next medical mystery is going to be very special.